questions. And now for our special guest. Pat Dunn has worked in the field of cardiac rehabilitation for 35 years as a clinical exercise physiologist and a program director. He is currently the program director for Connected Health for the American Heart Association, Center for Health Technology and Innovation, and is a contributing faculty member at Walden University College of Health Professionals. His area of focus is on the use of health technology to promote health literacy and build skills necessary to prevent and manage cardiovascular conditions. The topics we're going to be covering today will be understanding the benefits and risks of cardiac rehabilitation, new home-based cardiac rehabilitation, how it is safe and effective for most individuals, and how a discussion, we'll have a discussion on health technologies that are effective in cardio rehab settings. Okay. Pat, it's a pleasure to have you here. Welcome to Get Set Up. Take it away.
Thanks, Wade. I appreciate that kind introduction. Give me a moment here to get organized. And I just want to thank you. It's a pleasure to have the opportunity to do this presentation. So Wade has already kind of given an intro. I won't repeat myself here with that, but I just want to add to that. You know, my heart and passion is really in cardiac rehab. I know some of you on the call are patients, family members, or frankly, someone trying to avoid being a cardiac rehab patient in the first place. You're kind of in cardiac prehab mode. Some of you may be healthcare or cardiac rehab professionals. My focus of this presentation is going to be on you as the patient. This presentation is really not about how to run a cardiac rehab program. It is really from the patient perspective of primarily how to use digital tools to manage your heart health in a home-based or a hybrid cardiac rehab model. Also, there are many digital tools on the market. I'm not trying to promote any specific tool. So where possible, I'm going to use unbranded examples, but there may be a few cases where it may be obvious which tool I'm referencing. So cardiac rehab has been around since the 1970s as a way to help people recover from cardiovascular events, such as a heart attack or heart surgery, bypass or valve, an angioplasty or stent, or angina, which is chest pain coming from the heart or heart failure. The purpose of cardiac rehab is to build the strength of your heart. Remember that your heart is a muscle. So if you exercise, it'll get stronger. You can do more work with less effort, and you can increase your chance of survival. If you were to have a heart attack, a strong heart can compensate for the weak part of the heart. It also helps to prevent complications from prolonged inactivity. Cardiac rehab is also a good forum for managing your risk factors, such as your blood pressure, your cholesterol, your blood sugar, your behaviors such as your diet, weight management, and avoiding tobacco and managing stress. It also becomes a social support system and a great way to connect not only with your doctor and nurses, but also with other patients. But cardiac rehab is not just one thing. It includes exercise training sessions, meeting with your doctor and other healthcare professionals, and ultimately developing the knowledge and skills necessary to manage your health. Cardiac rehab has truly been shown to extend your life. Participants in cardiac rehab have greater survivability than those who do not participate. You have a significant reduction in your risk of having another heart event or needing to be hospitalized, and it certainly increases the quality of your life. Despite this, less than 1 in 4 eligible patients ever participate in a cardiac rehab program. There are a lot of reasons for this, including lack of awareness of the benefits, both by patients as well as by their healthcare team, a lack of access to a program, time and other logistical challenges, lack of motivation, and cost. Historically, if you didn't participate in a center-based cardiac rehab program, your only option was really a home-based, self-directed program. With the advent of technology, there is a potential to do home-based cardiac rehab while still being connected to your healthcare team. In 2019, the American Heart Association published a scientific statement that said that home-based cardiac rehab was as safe and as effective as center-based programs for most patients. This is important as home-based options may address some of the barriers, such as lack of access to a program. Also, home-based and center-based programs are no longer mutually exclusive. Due to social distancing, COVID forced many cardiac rehab programs to shut down and forced many programs to be more creative to avoid the scenario which left many patients literally sitting at home. For the 75% of patients that were not going to rehab in the first place, so this was already their reality. So a hybrid model for cardiac rehab is designed to provide a combination of both home-based and center-based rehab using technology as a lifeline. With a hybrid model, some of the sessions are conducted in the center under direct supervision, while the majority of exercise sessions and other activities are conducted at home using a combination of telemedicine, remote monitoring, using connected devices and wearables, apps and websites for education and support. Of course, if you're at high risk, you would still go to the center. But if you're intermediate risk or low risk, the majority of these sessions can be conducted at home while still being connected to your healthcare team. So what are the key elements of cardiac rehab? So I've created this educational program called Knowing Your Heart. So the way this works, everything kind of works in threes. There's 9 core elements, and each of these elements have three components. And these include knowing, checking, healing, moving, feeding, trimming, minding, cleansing, and connecting. And I'll explain what all of these mean. So the purpose of this presentation is to connect these concepts into how you would potentially use digital tools or use a hybrid program in your cardiac rehab program. We've also adapted this so that it also works for other conditions, such as knowing your diabetes or knowing your heart failure, atrial fibrillation, high blood pressure, and high cholesterol. So your heart really has 3 basic jobs: to pump blood out of the heart, to provide an electrical system to control the sequence and flow of blood, and to transport oxygen and other nutrients to all parts of your body. That's it. Measures of the pump include your blood pressure, your heart valves, and your ejection fraction, which is the volume of blood that's being pumped with out of your ventricle with each heartbeat. The electrical system provides the circuitry that generates a heartbeat for literally every moment of your life and is measured with an electrocardiogram. The transportation system is like a highway system. And as you know, if there's an accident or if there's construction or if the traffic is high, it can impact the whole system. But the transportation system is designed to transport oxygen and other nutrients through your blood to all parts of your body. Connected devices can be used to measure your blood pressure at home. The readings can be stored and shared with your physician. Smartphones can be used to measure your EKG and detect abnormal heart rhythms, such as atrial fibrillation. And a glucometer and a pulse oximeter are both examples of how to show how the transportation system is working. Basically, did the shipment get to the right location? Checking your heart includes 3 levels: the telescope, the microscope, and the stethoscope. So which are basically imaging tests, laboratory tests, and tests that your doctor can do in the exam room or that you can do at home. The telescope includes imaging tests such as echo, cath, or CT. These are done in a healthcare setting. You don't do these at home, but you will start to see interesting innovations using smartphone technology. The microscope uses laboratory tests such as cholesterol and lipids, glucose, hemoglobin A1C, electrolytes, and other biomarkers such as lipid testing like LP(a) and inflammatory markers such as HS-CRP, also cardiac enzymes such as troponin. So these are also by and large done in a healthcare setting, but in some cases can be done with a finger prick or through a home testing kit. The stethoscope includes items that can be measured by you and your doctor, such as biometrics like your blood pressure, your physical activity, heart rate, weight, as well as basically information that you generate yourself, such as an assessment of your diet or your level of stress. For you, checking includes your risk for having a cardiac-related event. The American Heart Association has developed Life Simple 7, which are really 7 domains of heart health that you can use to monitor your physical activity, nutrition, weight, tobacco, cholesterol, blood pressure, and glucose. Remote monitoring is a way to use technology to track these factors using connected devices and wearables. The most common remote monitoring use cases are blood pressure and glucose monitoring, as well as heart rate, physical activity, and weight monitoring. This type of monitoring can provide your doctor with more insights on trends rather than relying on measurements that are done in the exam room or relying on your memory. So a good example of that is your blood pressure. So your blood pressure may be good most of the time, but you get nervous when you go to the doctor and it's, abnormally high. Healing your heart includes 3 components: the medical component, a surgical component, and lifestyle factors. So the medical includes medications. Common medications for a cardiac patient include beta blockers to reduce the workload in your heart, ACE inhibitors and ARBs for heart failure and blood pressure control, statins for your cholesterol, and aspirin to reduce your risk of a heart attack or a blood clot. Surgical includes any procedures that you've experienced, such as heart surgery, a pacemaker, an internal defibrillator, or a stent. Lifestyle includes everything else. Yes, really, it means everything that you do to manage your health. Telemedicine can be used in a digital cardiac rehab model to bring healthcare professionals literally into your home using a digital interface. And COVID-19 has made these much more pervasive, using telemedicine to have a conversation using a system very similar to what we're doing right now. This might include direct conversations with your doctor or nurse, or direct but remote supervision of your exercise sessions. There are also a number of apps that focus on medication management. There are digital therapeutics that focus on symptom management and achieving what's called guideline-directed medical therapy. A key part of healing your heart is setting your priorities, goals, and action plans that are specific to your needs. So the first step is setting the priorities based on your conditions and other factors. For example, you might have heart disease, but also diabetes. Also, the relevant biometrics that you're going to track and the behaviors that you're going to focus on, as well as your overall medical plan. The goals should be aligned with your biometrics and your behaviors, and they should have both short and long-term goals. And then finally, the action plan should be specific to the goals. And all of these should be SMART. And that means they're specific, measurable, achievable, realistic, and timely. So let's get into the heart of the matter here, literally. So exercise is the best medicine. Moving includes 3 levels. So cardio, resistance training, and flexibility. These are all important for very different reasons. So cardio aerobic exercise is aptly named, and it's named for that reason. Your heart is a muscle, like I said, and if you exercise it, it'll get stronger. You can do more work with less effort. You're able to more quickly return to normal activities. And if you were to have a heart attack, you're more likely to survive. Your heart is a different type of muscle and prefers continuous and rhythmic activity. So it's different than doing push-ups or sit-ups. You should not be hyperventilating. And for sure, you should be able to do what's called the talk test. You should be able to hold a conversation with somebody while you're walking. The most common and probably best overall cardio exercise is walking. It's something everybody can easily do. You're not likely to be injured, and it's something you can do rhythmically and continuously. You can do resistance training, but you do need to be careful. If you hold your breath while you do that and bear down, the pressure inside your chest can rise dramatically. So check with your doctor and always be sure to monitor your blood pressure if you're doing resistance training. And finally, flexibility is often neglected, but a very important part of your physical activity plan. It's important to remember that all activity counts and it does not have to be done at the same time. So you can break your sessions up into small, even 5 to 10 minute sessions if you need to. Cardio ideally should be done 3 to 5 days a week and should be a duration of somewhere between about 20 to 60 minutes. If you're just getting started, you need to start slow and gradually build up. Ultimately, the goal is 150 minutes of moderate or 75 minutes of vigorous activity per week. But you're going to want to stay on the moderate side at first. It's better to err of doing it too slow, but maybe over a longer duration. Intensity can be measured by your heart rate, your breathing, and what's called perceived exertion, which is how hard you feel like you're working. So it should feel somewhere in the range of fairly light to somewhat hard. And do not, if you're a cardiac patient, use an age-predicted heart rate, because your meds will blunt your heart rate response, and that age-predicted heart rate is not going to be accurate. So how does technology work here? There are a number of wearables, and you can pick your favorite one, that track physical activity. They have different interfaces, but they all virtually track the same thing, which is steps and distance. For cardiac rehab, it's good if the tracker can also measure your heart rate so that you can monitor your heart rate response. This may vary depending on the meds, so that's why you want to monitor and you want to kind of track your own response. How high does your heart rate get from baseline? If your baseline is 60 beats per minute, does it go up to 90? Or if it's starting at 75, does it go up to 120? And you should really track that, or let the technology track it for you. Some of the trackers will also measure a form of intensity based on the heart rate and your step rate. For example, here's one example with Google Fit has created an algorithm which basically estimates whether you're in moderate or vigorous physical activity. If you've had a heart attack, you might not be able to get to 150 minutes. So don't use that as your initial goal. It's okay. You might literally be starting out with 10 minutes 3 times a week. That only gets you to 30. That's fine. Just try to do a little bit more each time, and gradually you'll get to that goal. Cardiac rehab has also historically monitored your EKG during the exercise session. And this can be done via a hybrid model by having the EKG monitoring done at the center, or using a system, a digital cardiac rehab system that does the monitoring through a telemedicine interface. Let's talk about food, feeding your heart. So food is the strongest drug you put into your body. So feeding really includes a couple of key macronutrients: fats, carbohydrates, and sodium. The key with fats is to move from saturated to polyunsaturated fats. Too much saturated or trans fat can increase your LDL or bad cholesterol, increasing your risk of having a heart attack or a stroke. Carbs, they've been kind of given a bad name, but carbs can be in good forms, such as fruit and vegetables, or bad forms, such as sweets. So too many carbs can make it harder for you to control your blood sugar and can increase your risk of obesity. Too much sodium can increase your blood pressure and make your heart have to work harder. Foods high in sodium come from processed and packaged foods, and from eating out, and frankly, from using the salt shaker. This is a big topic, and you can get overwhelmed in the details. Life Simple 7, the goals are at least 4 servings per day of fruits or vegetables, at least 4 servings of whole grains, less than 36 ounces of sugar-sweetened beverages in a week, and 1 serving of fish per week. And you can reduce sodium by avoiding packaged foods, by avoiding eating out, and by avoiding the salt shaker. Technology can be a challenge with nutrition. Food diaries are really hard. Pictures and barcoding may help a little bit, but you can also use your smartphone to just look up the contents on your phone. What I do now is, if I am going to a restaurant, or even sometimes when I'm in the grocery store, I'll actually look up the food in the restaurant. I'll look at the menu even before I leave for the restaurant. So I kind of have a plan in mind. So so that when I get to the restaurant, I don't, have a weak point and maybe make a bad choice. The best plan is to form a good eating plan. And two of the ones that I would recommend are the Mediterranean diet and the DASH diet. If you're really motivated, you can also be considering a plant-based diet. Not everybody can be successful at that, but if you can do it, it definitely will improve your overall heart health risk. In addition to changing the foods that you eat, you also may need to change your eating pattern. This is where trimming your heart comes in. And key factors here are your portion size, your eating habits, and intuitive eating. So portion size, just looking at the, look at the serving sizes literally. Eating habits, are you grazing in the evening? Are you eating breakfast? And intuitive eating, really looking at how hungry are you when you actually are eating the food. Eating patterns involve paying more attention to your nutrition. This might involve learning more, getting more involved in food preparation itself. The more you're involved in it, the more it really becomes real for you. It might also give you a better appreciation for the food as well. Some people eat the right food, they just eat too much of it. So plan your meals and don't get too hungry. If you're too hungry, that's when you tend to overeat. There are nutrition and weight loss solutions on the digital market, programs such as Noom. So again, you can try some of these out and see if they work for you. Finally, heart health. The health of your heart is in your mind. Well, sort of. It's very normal to be depressed, anxious, or stressed following a heart event. And it can impact your ability to manage your other factors. In fact, almost everybody that has a heart event is going to have some sort of depression, anxiety, and stress. If you didn't have any of that frankly would be concerning to me. So pay attention to your mood and your emotions. Practice your breathing, just like you put in effort into your diet and your physical activity. Put effort into calming your mood and practicing relaxation. There are some smartphone apps that will help you practice your breathing. Basically, what you want to do is what's called belly breathing. So expand your diaphragm, expand your belly while you're breathing, which frankly, the air isn't literally going into your gut. What it's doing is just more fully filling your lungs. There also are some really good solutions on the market for things like depression, anxiety, and stress. One example of a program that we actually co-created with a solution called FAHA it's called Heart and Mind, and it works kind of at the intersection of cardiovascular and mental health using a gaming approach. Cleansing your heart is about doing good things for your heart. So getting plenty of air, water, and sleep. So air and water are old school and low tech, but very important. Air, good breathing can help you with your stress. Water can help you, especially control your appetite and help you to avoid overeating. And sleep is incredibly important for your heart health. It's important for your blood pressure control. And it's just important for your overall health, both physically and mentally. And it can be tracked in most activity monitors. This final section, it's a new section, it's called Connecting Your Heart. So the key here is setting up your support system, also making sure that you have a forum for asking questions and sharing information with your healthcare team. These functions can be done through your apps and portals. It can also be done through secure social media platforms. You got to be careful with the social media for obvious reasons, but there's also some things that can be used to benefit this way. But this is an incredibly important piece of your picture, is setting up this system and frankly learning how to communicate with your doctor and your healthcare team. So how does this look in a hybrid model? So the first thing is to figure out who needs to be in a center-based program and versus what's done in a home. So a person that's high risk needs to be in a center. What is high risk? So certainly anybody who's experienced cardiac arrest, Anybody who has a really low ejection fraction, or frankly, just a weak heart, those would be examples. Anybody who has abnormal heart rhythms, you would want to be monitored and under direct supervision. But on the other hand, the majority of the people, you may have barriers that prevent you from going to the center. These might be, things like you don't have access to a program, it's too far, or the hours don't work because you're trying to get back to work. So in that case, a hybrid or a home-based model might be a good option. Typically, a hybrid model starts with a one-on-one visit, and this can be done at the center. It can be done over the phone, or it can be done through a televisit. The exercise sessions can begin in the center, and then again, based on your risk level, as well as your ability to kind of self-monitor your activity, it can move into the home-based setting. And then you can follow that with periodic visits. And again, some of those visits can be done in the center. Some of those visits can be done using a virtual platform. So what are the safety and effectiveness issues related to doing a home-based cardiac rehab program? The first one is to be aware of your environment. This includes both heat and humidity in the summer, as well as cold and ice and wind in the winter. In all cases, you always want to stay hydrated, especially before, during, and after your exercise. Also, always listen to your body and report anything that's new or worsening to your healthcare team. The worst thing you can do is say, well, I don't really want to bother my doctor, or it's really probably not important in the first place. Remember taking small steps. Rome was not built in a day, so be patient with seeing results. And remember that it's not just one thing. You do have priority areas, but remember that your heart health is multifactored. So you can't just exercise and ignore your diet or your stress. You have to kind of do the whole thing. Your mind and your body are connected. So you need to take care not only of your physical health, but also of your mental and emotional health. And finally, remember that this is a journey. And frankly, it never really ends. The end of your cardiac rehab program is literally when your heart stops beating. So don't think of it as maybe like a 12-week program. There's different phases to it, but you should always be monitoring and trying to manage your heart health. So where do you start? How does this technology fit into this? So I've mentioned there's a lot of different ways to use technology. As individual items, these may include things like connected devices, things like for blood pressure and glucose. Could be wearables or biosensors for physical activity, heart rate, sleep, temperature. Could also be apps and websites to access education and information. And it could be telemedicine to connect you to your healthcare team, and also social connections to help you, connect with your caregivers and your patients. There are digital cardiac rehab programs, and they're kind of sprouting up, kind of in the due to COVID and hopefully, literally life after COVID. And what these programs can do is they can package these things together, or if you're doing this by yourself, you can do it, kind of in an a la carte manner. Some things to keep in mind. You need to pick what works for you and pick what you will use. So it doesn't do any good to go out and buy expensive technology if you're not going to use it. And frankly, you need to understand where the information is going. Is it just going to you to help you self-monitor, or is it being shared with your doctor? Include your technology into your priorities, goals, and action plans. So if you're tracking your blood pressure, find a validated blood pressure device and use technology that's compatible or interoperable with your healthcare team. So ask your doctor if they use a particular system, and is there any way to share your information? They will find it very valuable and frankly, much more meaningful than you coming in, with, numbers written on a Post-it note. Finally, my suggestion is start addressing your stress and emotions. An important part of this is establishing your support system. which you can do, with your family and friends, your coworkers, your healthcare team. And digital tools are literally, they're tools that can help with this. They're not going to completely solve it, but you have to address the stress and emotions first. Otherwise, it's going to be very hard to succeed at the rest of your cardiac rehab program. So I want to thank all of you, and I'm happy to share or answer any questions that you have.
Thanks, Pat, for that. That was a great presentation. So as Pat said, we'll move into the question and answer phase at this point. So if you have questions, feel free to put them in the chat, and you can get them to us that way. If you would like to ask a question out loud to Pat, raise your hand via Zoom, and we'll call on you and you can ask your question out loud. Or if you want to follow up on a question, same thing, just raise your hand. We have a couple of questions here already, so let's get started with them while the rest of you are getting your questions together. One person has said that they have trouble with AFib, and they're allergic to a lot of medications that they're using today for AFib. The person has taken digoxin, but it's no longer helping her heart rate. Any ideas?
Any ideas? Yeah. So first of all, for sure, any kind of medical questions, be sure to always talk to your doctor about. There are some surgical options now that are available to, the big risk with AFib, if you think of it, how the blood is flowing, basically the AFib is creating a more turbulent flow. So think of it like a little river that all of a sudden has a bunch of rocks and different things in it, and it makes a lot of turbulence. And what can happen is the blood can get caught, especially in the upper chambers of your heart. It can then form blood clots, and then those blood clots can go up into your head and cause a stroke, or they can cause a heart attack. So the real key factor is, avoiding that turbulence. So the medications are used to thin your blood so that you're less likely to get a clot. There are some surgical ways to make it harder for that blood to collect in your upper chambers in the first place. So those are some key factors. The other thing, as it relates to the technology, is some people go in and out of atrial fib. So you may be in it, certain parts of the day and not in it other parts of the day. There are devices that can be connected to your smartphone that you can actually use to detect AFib. Again, this will be very valuable information for you and your doctor in determining how aggressive you need to be in treating the AFib.
Thanks, Pat. See, Terry has a question. Terry, you want to ask your question? Go ahead and unmute.
Yes. I wonder if you can comment on the variability of blood pressure measuring machines. I went to the dentist yesterday, and she used one that fit around the wrist, and I got a reading that's a little high, but the one I use at home is the cuff that I measure here. And even when I took it to my regular doctor and compared to what the nurse got, it was off like 20 points. So so we actually don't recommend wrist cuffs for blood pressure. We do recommend the traditional cuff that's on your upper arm. Even with those devices, you want to try to use devices that are what are called validated devices. And so I can put it into the chat, but there's a site called validatebp.org, and it's a site that was developed by the American Medical Association, and it'll show you which devices have actually gone through a validation process. And so, some of the name brand ones like Omron and Withings, Microlife, those are validated cuffs, but you should always check. Don't just buy the cheapest cuff out there, because you do want to make sure that it's accurate. Another part of being accurate is making sure you're using good blood pressure technique. So that cuff should always be at the level of your heart. So if you're lying in bed, or if you're doing something where it's at a different level, it's not going to be an accurate reading. You should also have both feet on the floor, and you should be in a relaxed state when you're taking your blood pressure reading.
Okay, see, Janice also has a question. You have a hand raised. Go ahead, Janice.
Hi, thank you for speaking with us. I had COVID a couple years ago when it first started, and I went into a coma, and I've been bedridden ever since. Is there any kind of heart exercises or something I can do? I can't stand up on my own. Well, I can't stand up at all. And then my second, I was wondering, should I take baby aspirin with 5 milligrams of Eliquis I'm on, if it's okay?
Yeah, so the medication question, always check with your doctor. So that's one of the key things with the technologies. Find a good way to communicate and ask those questions with your doctor. It would be very inappropriate for me to tell you whether you should or shouldn't. So talk to your doctor. Regarding your COVID and being bedridden, you would probably be a good candidate for home health. So having a physical therapist, come out and have that therapist not only help you while they're there, but ask that therapist what are some things you can do. Even being bedridden, even doing things like leg raises and arm raises, and it does a couple of things. Number one is it improves your blood flow. It does, burn some calories and help you with your, circulation. And because of that, it'll help with, bed sores and even getting a blood clot, which is a big risk. If you've been bedridden or pretty inactive, that's a big factor. So I would say, check with have a physical therapist or a nurse that's doing your home health, give you some exercises that you can do even while they're not there.
Okay, thank you. My second question was, can I have my laptop on my chest over my heart while I'm working on the laptop? I mean, the electricity doesn't harm the heart or anything, does it? Okay, great.
No,
thank you so much for coming to talk to us. I appreciate it.
Yep.
Thanks, Janice. Pat, we have a question about whether gut biome plays a factor in terms of heart health.
See, I didn't quite catch the question. Can you repeat that?
Gut biome, the gut microbiome.
Gut biome. So, everything's connected. So I'm sure in some way it is, having good, digestive health is good for your heart. I can't speak to specifically, I don't know if there's any research necessarily on, the connection between gut biome and heart health, but I'll have to leave it at that.
Okay, there's a question about eating sweet potatoes and especially sweet potato chips. Are they good, bad, indifferent?
So when I was talking about carbs, so carbs have been given a bad name a little bit. Some of that's justified, some of it's not. So potatoes, are kind of a starchy vegetable. They are loaded in carbs. But carbs are not all bad. And certainly potatoes themselves have a lot of really good nutritional value. When you get that potato in the form of a potato chip or a French fry or things like that, or, then, it starts to lose a lot of that nutritional value. So I would say, and sweet potatoes, again, a lot of good nutrition, but everything in moderation. So really be aware of portion size. Some sweet potatoes are just so yummy, it's easy to overeat. And that can lead to, problems with your blood sugar control and just your weight control.
Okay, all right, great. Let me see. Should people have regular heart checkups? And if so, at what age?
Yeah, great question. So yes, and start early and often. I know that's not very specific, but you should establish a good relationship with a primary care physician. Even if you're already a heart patient and have a cardiologist, you should always also have a primary care physician. If you're younger and don't have heart disease, you should, again, always have a good baseline physical. And you should get, if you're at low overall health risk, I think the recommendation is a lipid profile like every 5 years. But honestly, if you can have an annual physical and have annual blood work, That should be a minimum. Now, if you have heart disease or hypertension, or have had a heart event, then those things need to happen much more often. You should be monitoring your blood pressure. There's really no reason not to monitor your blood pressure often. Whether it's through home devices. If you don't even have a home device, you can usually go to a drugstore, a Walgreens, or a Dollar General, and you can get a blood pressure reading there. So try to get a blood pressure reading, at least once every 3 months, and ideally even more often than that.
Okay, great, thanks. Another question is, what do you think is the biggest mistake most people make after a heart incident that sets their recovery back?
Yeah. So there's a lot of opportunities for mistakes. One mistake that can be made is the feeling that you've been cured. So if you've had, maybe heart surgery or a procedure, that doesn't necessarily mean that the underlying cause of your condition has been addressed. So you always want to stay vigilant with that. If you've had a heart attack, again, you always want to be, laying the odds. What is the chance of this happening again? And so a mistake there can be not addressing that underlying cause. Was it high cholesterol, high blood pressure, diabetes? Maybe it's your family history. You can't really change your family history, but just being more aware of your overall risk can be helpful.
Great, good information. How can you best support a loved one who is recovering from a heart incident?
Yeah, so I'll tie it into your question. You support them by loving them and being supportive of them. So I mentioned right at the end, the key factor, and probably the first thing you should do, is set up your support system. If you're the support system, you need to make sure that you are that support system. And you may be a conduit to the medical team, but you may just be there. You just may be, and you may be another patient. You may be a family member. You may be a coworker. But being there, being available, that's so important.
Great. I'm sure there's a lot of psychological effects of having a heart condition. How can people get past those psychological effects?
Yeah, it's very natural, almost normal to have psychological effects. It's not a matter of, will I be depressed or anxious or stressed out? It's really, how long will it last and what do I need to do to manage it? In some cases, it may require medications. In some cases, it may require counseling or therapy. In other cases, it may be things that you can do, even just good relaxation exercises. Find what works for you, if it's listening to music. But the key to stress management is learning how to manage your breathing. To the extent that you can learn good relaxation breathing, and there's a lot of different ways to do it. Just breathing. There's doing things like yoga. There's meditation. There's prayer. There's listening to music. There's walking. There's a lot of different ways to do it, but find your kind of safe, happy place and be there as often as you can be.
Okay. All right. Yeah. So there's a question. Please discuss the catch-22 between cardiovascular and diabetic.
Yeah. Well, it's not really even a catch-22. They're just kind of linked together. So, I mean, diabetes is almost, a part of heart disease. Diabetes is a condition of it in and of itself as well. But so you almost have to think of diabetes as a form of heart disease. Okay. If you have diabetes, you are at risk for having heart disease. Certainly, even if you're not diabetic, you should be aware of and be able to monitor your blood sugar, and know what those numbers. You should know your blood sugar or glucose reading just like you know your cholesterol level.
Very good. Do you think there are any risk factors associated with heart tech?
Risk factors for heart tech. Well, probably the biggest concern is on the social media side. So don't let social media get you into a very dark place and actually make you even more isolated. So, that's probably the biggest, concern and risk in using technology. The other thing is don't use it in a vacuum. Make sure that the information that you're using, the data that you're collecting, you have a way to share that with your healthcare team. And it might be your blood pressures, it might be your physical activity, it may be monitoring your signs and symptoms. So let me go back to a question. A lot of people make the mistake, when we talk about symptoms. Another mistake that a lot of people make is they ignore their symptoms, or they assume, or frankly, they hope that the symptoms will go away. So especially chest pain, that is a clear indication that something's not going well. For the women in the audience, your chest pain may not present as classic as what it does for a man. It may present more as, other things, shortness of breath or fatigue or different factors. So any kind of symptom that's new or worsening, always pay attention to it and always let your doctor know about it.
Kind of staying on the tech topic for a minute. Can you talk about the pros and cons of smartphone-based apps versus wearables like watches? Is one better than the other?
Yeah.
Cost factors.
Well, most of the watches, like an Apple Watch, are tied into your smartphone. So typically, if you're going to be using a watch to be tracking your, things like your activity, it's going to be connected to a smartphone. There are, sometimes cost factors involved with all of these gadgets. So it doesn't mean that you have to use always the most expensive version. You can track your activity, with just a regular pedometer or tracker, and you can use your just a regular flip phone. But I would say that, if you are a cardiac patient, not only having, a smartphone and a tracker or a watch, but try to get one that will accurately measure your heart rate. That's a good indication. Your heart rate is the single best predictor of how hard your heart is working. So if you can look at your watch and see that your heart rate is high today, that's an indication of something going on. So find something that can track your heart rate. If you can track your EKG, that's even better. But try to find something that can track your heart rate.
The related question, any comments on Garmin watches?
Yeah, so the Garmin, Fitbit, Apple, Samsung, they're all kind of very similar. They all track very similar things, do very similar things. So, we've had good experiences with Garmin technology. Again, with the technology, if possible, try to find something that's interoperable or compatible with what your doctor is doing. If your doctor has a way to track things, find what technology they're using. In many cases, they're not using anything, so then it really is kind of up to you. And Garmin's a good choice.
Again, sort of related, where can people go for more resources on cardio health tech?
Yeah, so you can certainly go to the American Heart Association site. It's easy, it's heart.org. For more information on heart tech, you can go to, so our website, it's ahahealthtech.org. I'll put that in the chat. But for general heart health, the American Heart Association, it's heart.org would be a good place. There's other sites as well, but that's, for me, that's, for cardiac rehab programs. There's also the, it's called the AACVPR, which is the Cardiac Rehab Professional Organization. They'll have information on cardiac rehab programs in your area. So if you are looking for, you might be surprised. There might be a program right down the street that you just weren't even aware of.
Okay, so I got one last question for you. So we've talked about your extensive research on this topic and the work you've done with the American Heart Association. What can we expect to see from you coming up next?
Yeah, so the main thing that I work on are what we call care plans. And these are digital care plans that are built into many of these technology platforms. And it's basically, the information that you need to manage your health. And there's different versions. There's some for blood pressure, some for heart failure, some for AFib. There's actually even one for cardiac rehab. So that's the primary research that I do. It's tied into my research on health literacy. So basically, do people understand the information that's being provided to them through their technology platform? General health literacy is basically, do people understand the information being shared with them by their doctor or their healthcare team? So if the doctor's talking to you, do you actually understand it and can you act on it? My research is based on, okay, if you're using a wearable or an app, do you actually understand that information? And does it actually help you in managing your health?
Okay, so thank you, Pat. It's been great having you here today to teach us about cardiac rehab. We appreciate all the great information you've provided to us.
Okay, thanks. It was a pleasure.
All right. And you can learn more about Pat by visiting his website and connecting with him on social media. You can see these links in the chat now, and they'll be included in the email following this event as well. What we'd like to do at this point is to take a moment and capture a group photo. So if you feel comfortable turning your camera on, go ahead and do that and smile, and we'll take a snapshot.
Thanks, Wade. We got it.
Okay. All right. Great. So I do want to thank our audience here in the front row and in our live stream communities. If you'd like a recording of this event, please email our support team at help@getsetup.io. If you're new to Get Set Up, we hope you've gotten a taste for what we do. We have over 500 online classes weekly, all designed for older adults and taught by older adults. The classes are free as we work with local governments, community and Medicare organizations who support their members with free classes. I also want to draw your attention to some relevant classes on Get Set Up. If you like this event, we have other classes we think you would find interesting as well. You can look for the link to sign up in the chat here on Zoom in our live stream, or you can go to our website, www.getsetup.org. And remember, everyone who registers will receive an email after this event with the follow-up links we've talked about and notes, including links to some relevant classes and other exciting guest speakers coming in the future. We look forward to seeing you in future classes and want to thank you all for attending and have a great day. Bye now.